Welcome to Healing with Zen, a space where we can deep dive into Chinese medicine and acupuncture and how it can help everyday people like you. Today we're talking about fertility and pregnancy care. We're going to have a real conversation about what's missing in conventional care and how we help our patients holistically. My name is Zen Tuan. I'm a licensed acupuncturist, herbalist, and founder of Healing with Zen. Our practice is located in Pasadena, California, and I'm excited to have our Dr. Kiara from Healing with Zen here to facilitate this discussion.
Yes, I'm so happy to be here with all of you. And let's just dive in so I can ask Zen a ton of questions. So first off, why do so many people feel like fertility struggles are invisible or isolating?
I think it's because people are dealing with fertility, pregnancy in a very private space. They are trying to get pregnant and they're having difficulties, but yet they feel embarrassed to talk about it, or sometimes they feel like there's shame or that they don't know how to express themselves. And if you know somebody who's been trying again and again and failing, you almost feel bad to talk to them about it too. So I feel like sometimes people just feel really lonely after a few failed attempts.
Yeah. What drew you into fertility as an acupuncturist?
Well, really, it was more of my own experience. Where do I even start? Okay. When I got married, I had been treating a lot of fertility patients already, and I saw that it took a really long time for patients to get pregnant. So I told my husband, let's try right away. And of course, I got pregnant in the first try.
Wow.
But my pregnancy was actually really difficult. I had a really hard pregnancy with a lot of aches and pains and really difficult labor and delivery that didn't go the way I wanted to go. And so a few years later, when I got pregnant again, it ended up being a miscarriage, a chemical pregnancy. And so I feel like with my personal experience, I relate to a lot of people who have gone through the losses.
Right.
So a few years later, when I tried again, it took a lot longer to get pregnant. And when I did, the third time when I got pregnant, I had a really, really great pregnancy. And I did all the things. I did the acupuncture, the chiropractor, the PT, I was doing all the stuff. And I feel like with my experience, I feel like I relate a lot to these people who are struggling with fertility. And I know how much it has helped me through my pregnancies and postpartum. So that's really why I like treating this demographic now.
That's fantastic. I love that. Do you see any specific patterns with people who are trying to get pregnant?
Yeah, a lot of times I have to really be upfront with patients and ask them emotionally how they're doing, because I feel like there's a lot of emotional baggage that people hold on to and they can't get pregnant because they're holding on to things, whether it be loss, anger, irritability. I have so many patients that have tried again and again, and finally it's like, what is that emotion that you can't let go of? You have to let it go so that you can get pregnant, and they do.
Interesting.
And what's cool is acupuncture can work on that very emotional level too, right?
Yes,
So it comes down to
definitely.
having that talk too.
Yeah, I've had a few patients that cry when they're on the table and they're really shocked by it because they can't get themselves to cry normally. And then they're like, "How did you do that? What did you put in the needles?" I'm like, "There's nothing in them. It's a release." What's something patients are shocked to learn about their bodies once they start getting acupuncture?
So I think a big thing I love teaching patients is that your menses can come and go with no issues. Meaning there's no cramps, there's no PMS, there's no bloating, distension. You shouldn't have your emotional fluctuations. In Chinese medicine, we say when everything is flowing smoothly, then your period should come and go super easy. No issues at all, and always on time. And I think patients are like, is that even possible?
Yeah.
And I get a lot of patients there, and then they're able to get pregnant easily.
Yep. Yep. How does Chinese medicine view fertility versus Western medicine? What's the difference?
I think in Chinese medicine, we look at the body more holistically versus a lab report where this hormone is off, or you need some estrogen or whatnot. Instead of just focusing on numbers, we really look at lifestyle and what the patient is going through overall. Like, how are you sleeping? What's your diet like? How are you digesting your food? Emotionally, how are you feeling? And then we treat all of that together cohesively so that the patient's body is well nurtured and nourished and ready to get pregnant.
Totally. What systems are we supporting when we do fertility acupuncture? What are we doing exactly?
Yeah, I mean, acupuncture, there's been so many studies that show acupuncture does so much for the body, right? First of all, we are balancing a lot of the hormones. So it's not really about this hormone is off and that hormone is off. It's about let's bring it back together and balance it out. Also, we are releasing all the feel-good hormones, the endorphins, the serotonin. That's why people feel nice and relaxed when they're getting acupuncture. We're supporting blood flow to the uterus and to the ovaries, and overall the nervous system, like really bringing down the sympathetic system. I feel getting people out of the fight or flight is the biggest thing about helping them get pregnant.
Totally. Why do we focus so much on stress even when labs look normal? And I've seen this too. I work with autoimmune patients, and a lot of times their labs will be like within the normal range, but they're still having flare-ups or symptoms. So what's that about?
Yeah, I mean, I feel like when the body is so stressed out, your body is just not working as well as it can, right? So I feel like instead of focusing on the numbers, it's like let's bring down your stress levels. Your body is smart. It's naturally going to know how to rebalance and how to conceive if everything is working
Given the
smooth.
right conditions.
Exactly.
Yeah. What is one thing you wish patients knew earlier when they were trying to conceive?
Not to put so much pressure on yourself. Like back to the whole stress thing again, it's more like let things flow. Things will come when you're ready. Your body will know when you're ready. So don't say I need to get pregnant by
Right.
this day. A lot of my patients are like, okay, so I need to get pregnant by December so that I can have my baby by this day so that I can go do this. It's like it really doesn't work that way.
Yeah. Yeah, totally. At what point should someone actually start thinking about fertility support, especially with Chinese medicine?
That's a great question because if you have any inkling of wanting to get pregnant, I feel like the sooner the better to just start balancing out your body. Acupuncture and Chinese medicine, there's no harm in doing it at all. If anything, it's going to increase your overall health and your overall viability to get pregnant when you are ready.
Yep. Totally.
Preventative, right?
Yeah.
Preventative versus anything after the fact of a diagnosis.
Yes. And also, like she was saying, with trying to get your cycles in order, if your cycles are irregular, pain, PMS, all the things, coming in and getting that under control so that, whenever you do decide to get pregnant, you're in a really good spot to do so.
Exactly.
How does acupuncture and can it support patients going through IVF or IUI?
Yes. So I have a lot of patients who come see me after they've tried natural ways for so X amount of time. Then they go in and do the IUI and maybe not successful. And then now they're looking at IVF. And acupuncture can help the body through all of those different modalities.
Stages.
Yeah, because we're preparing the body before ovulation, getting the blood flow to the uterus, getting the uterus lining nice and thick. And once it's ovulation time, then we're trying to help the body conceive and hold on to any kind of pregnancy that might be viable. And then if they're not pregnant, then we're helping the come down of all the hormones and letting the period come naturally without any issues. So we've helped many people at the IVF clinics. We usually do the acupuncture before they do any kind of embryo transfer and then immediately right after the embryo transfer. And there's been studies that shown that this has not only calmed the sympathetic system and helped the patients feel more calm during their treatment, but that it becomes more viable for full-term pregnancy.
Yep, definitely. And when should someone start acupuncture if they are planning to do IVF?
I always tell patients the more time I have, the better. Your cycle only comes once a month, right? So ideally, let's try 3 months before your cycle to at least start to regulate and see what's your pattern and to facilitate the body. So I usually say at least 3 months.
3 months, okay. But probably like a year.
That'd be
right?
great.
Usually
if you
it's
had a
like
year, you probably don't even need the IVF.
Yes,
You know what I mean?
that's true. That's true. Can acupuncture still help if someone has what we deem unexplained infertility and their doctor can't figure out why?
Yeah.
Can
And this
acupuncture help?
Yes, and this helps. Okay, and this is a big point: is that a lot of times things look normal, but yet somebody tries and they can't get pregnant, right? And the doctors can't explain it. And yes, acupuncture helps because, like I said, there's so many factors like the nervous system being on overdrive. Maybe they just need a little bit of circulation to the
Circulation,
uterus,
yeah, that's a big
or just a little bit of support with sleep and emotional health can make a huge difference too.
Definitely. Once someone gets pregnant, yay, how does acupuncture and can it help them through each trimester?
Absolutely.
What is it good for there?
So a lot of times when people first come in for fertility acupuncture, I actually go on and talk about pregnancy because the final goal is not even just to get pregnant. The final goal is to have a successful full-term pregnancy with a happy, healthy baby and a happy, healthy mom, right? Like that's really the goal because once you get pregnant, it doesn't mean you're going to stay pregnant. So usually with my fertility patients, when they are pregnant during the first trimester, it's still really critical that they come. They're coming once or twice a week for the whole first trimester just to sustain the pregnancy, especially if you've had losses in the past, right? And then at the same time, we're treating any kind of hormonal issues like people start to get morning sickness maybe, or difficulty sleeping, increased urination, which they always think it's third trimester, but first trimester is really bad. So just things like that. By the second trimester, we are not seeing the patients as much, especially if they're feeling well, then maybe they check in once every 3-4 weeks, right? And then by the third trimester, I'm seeing patients a lot again, especially by week 32. They're going to know if the baby is in place, and if the baby is breech or whatnot, that's when they're coming in a lot more often to try to rotate the baby or try to get the baby in the right position. Also, we're starting to work on low back pain and getting the body ready for labor and delivery. So third trimester is when I see a lot of my patients again too. And don't forget the postpartum. People forget, after baby comes, it's all done, but it's not because the mom's body is still healing, and there's so much that needs to be done afterwards.
So much stress. So much stress. Yeah. You kind of touched on it, but are there any symptoms that you see with a lot of your pregnancy patients, like nausea? You kind of mentioned that. What are those symptoms that you see?
I see a lot of headaches and migraines. And when you're pregnant, you don't really want to take Tylenol or take any medication, right? So I get a lot of the headaches, the common cold, and also things like pelvic pain, the typical low back pain, neck pain, nausea, constipation. But towards the end, there's a lot of the stress and anxiety that comes with labor and delivery. People start to get nervous about that. And even along the way, things that come up like there's been hematomas that patients have had, or they have placenta previa, or if they have gestational diabetes, these things come up along the way too. So if they're given that kind of diagnosis, then we're working on that. And I'm happy to say that we've been able to clear a lot of these people of these issues, like manage the blood sugar, make sure the placenta previa doesn't show up anymore and such.
That's great. Yeah. We're talking about acupuncture and pregnancy. So is it safe, and is it modified at all? Can people rest easy knowing that we know what we're doing and it's modified in a way that's okay for pregnant people?
Yeah, absolutely. Acupuncture is so beneficial for pregnancy. There are these specific points that we say are forbidden during pregnancy, but and of course we don't touch those. I want to say 6 to 12 points, right?
Yeah.
But besides that, acupuncture can help our pregnant moms with so many different symptoms. So they find great relief using acupuncture and Chinese medicine.
Definitely. What does Chinese medicine say about recovery after birth? What's the big thing that women in China do?
So there's what we call a sit month. It's 30 to 40 days after you you have your baby. You're supposed to take it easy and rest. You are not supposed to do any kind of housework or be up and about. You're supposed to be taking these nourishing soups and herbs and eating really, really healthy just to regain all that energy back. Because we say that the labor is, big trauma for your body, right? And you need to recover. And we actually say that during that time, it's very vital. If you don't do a good sit month, then later on in your life, you're going to have a lot more health ailments. So menopause will be harder, and other hormonal shifts may happen if you don't take care of yourself postpartum.
Yeah, that makes sense. What is the one thing that you want everyone to know who's struggling with fertility to hear?
That you're not alone, that there's a lot of other people out there probably in your situation that have felt difficulty or loss, and may also understand how you feel. It may feel isolating, but there's all these support out there. There's people like us that help you all along the way, every step. There's so many nice healing modalities, and reach out for support. Don't be scared to do that.
Definitely. definitely. If someone is feeling discouraged or burnt out, what is your message to them?
Surround yourself with joy, with things that make you happy. Do you want to find that happy place, because when you do, I feel like that's when you're most susceptible to get pregnant.
Yeah, definitely. And feeling safe in your body, finding people you can be safe around, an environment, all of that. And that will help your womb also feel like a safe space for an embryo to implant into. So, yeah.
Yeah, I forgot to say that. I usually tell patients that you have to keep your abdomen warm.
Yeah, oh yeah.
Like I
Yeah,
always say,
yeah.
no midriffs while you're trying to get pregnant. You know, you
No.
want to keep this whole area, even including your glutes, warm.
And the
And your
back too.
and your feet. You always want to wear
Feet,
socks.
yes. And neck. So the whole body, just your whole body. You want to
Yeah, you want to keep the temperature warm because it wants to be like an oven so that you can bake a bread, right?
Yeah,
Bake
yeah.
a bun.
Same with what you're ingesting too. So no ice water. Try to keep everything else like food wise to room temp if you can, or warm, hot. Yeah. Good. Anything else?
No, I think that, through all my years of practice, I've been practicing since 2013. It's been amazing being able to help these women eventually get to the end goal of getting pregnant. And then it's even more rewarding to see a live baby at the end. So,
Yeah, it's really satisfying.
yeah, it's nice. It's a struggle. And for some women, it's fast. They'll come in to get acupuncture one time and like, oh my God, then I'm pregnant.
Yeah.
But then for some people, it's still a struggle. We go through months, sometimes year, or so. And but just know that your body is able and very strong and can do it. You just have to be in the right mindset and treat yourself well, and it'll come when it's the right time.
Perfect. I love that. Are there any case studies that you want everyone to know about?
Well, there's a few that stand out, but one of them I think a lot of people can relate to. She was a really beautiful 30-year-old woman who was diagnosed with PCOS, and she had been trying for a long time. It was 3 years or so, and she was
wow.
told that you need to do the IVF or IUI route, like you're not going to get pregnant. But she was really determined to have like a natural pregnancy, and so she started to come see me, and she was very good about her treatment. She came in every week, and we got her on herbs. And it's hard because you go through month and month and month. But I think by the 11th month is when she finally came in. And I'll always remember her eyes. She's like, Zen, it actually happened.
Oh.
Because with her PCOS diagnosis,
Yeah.
she was told so many things, right? And so she really didn't think it was possible. She was getting ready to do the IVF route in like a few months after that.
Wow.
And so, I mean, there's also people who have just gone through so many runs. I just can't believe it. There was another girl that went like IUI, then IVF, fail, IVF, fail, IVF, fail, and finally she did it. But it comes down to using the acupuncture to emotionally get ready for that too. That's what they do. And I always tell them in between your cycles, you need to let your body rest.
Yeah.
When you do the IVF, a lot of doctors will just say, okay, well, it didn't work. Let's do it next round. Like, you can't do it next round. You need to let your body reset for at least 1 to 3 months, at least the minimum.
That's good to know.
Like why you just did hormones. If it's not successful, you're gonna do hormones.
It's also
again.
very emotionally taxing to go through a cycle of IVF. So, yeah.
So these things take time and tenacity, but yeah. Well, thank you, everybody. This was a great conversation. I hope it was helpful. Please forward this to anybody who might be struggling or might be going through some pregnancy issues. We'd love to see if we can help. Thanks for watching, and we will see you in the next podcast. Bye.